Welcome back. In today's video, we are going to learn what a hemoglobin A1C really measures and why it is more than just a number. And if your hemoglobin A1C is high, how much of a drop can you realistically expect in just 3 months? Also, the most effective research-backed ways to lower your hemoglobin A1C without any extreme diets or any gimmicks. But make sure you watch all the way to the end, because you will learn the one overlooked lifestyle factor that can improve your hemoglobin A1C without you having to change your diet or exercise. Most people never see this one coming. Hi, I'm Dr. Joanette, and I've been an ER doctor now for over 30 years. I'm a Blue Zone native and also the founder of Optimum Health MD. At Optimum Health, we are focused on not just avoiding disease, but helping you live at your healthiest and highest level. I remember there was a patient who came into the ER with symptoms of extreme fatigue and unexplained weight loss. His hemoglobin A1C was 10.2, and he really had no idea what that actually meant. He knew that his doctor had told him that he had a little blood sugar problem, but it wasn't anything to worry about. And if he watched his diet, got some more exercise, he would probably be able to fix it. No problem. What he wasn't told was what that little blood sugar problem actually meant. And more importantly, he wasn't given any guidelines on how to actually fix it. He initially tried to follow his doctor's advice, but it was so vague that he wasn't long before he was really just back to his old lifestyle habits. Now, many months later, in my emergency department, that number would change everything. Hemoglobin A1C is more than just a score. It is your 3-month average of how well your blood sugar behaves. For him, that meant his blood sugar average was 246 during the last 3 months. It should be under 100. The question that he and many others have is, how much can I realistically lower my hemoglobin A1C? So let's take a look at what's truly possible. Hemoglobin A1C doesn't measure your blood sugar at the moment, like right now. What it does is it measures the average amount of sugar that your body has been exposed to over the last 2 to 3 months. Inside our red blood cells is a protein, it's called hemoglobin, and it carries our oxygen. When sugar or glucose is in our bloodstream, some of it binds permanently to that hemoglobin. This process is called glycation, and once a protein is glycated, it doesn't function properly. Your A1C is the percent of glycated hemoglobin in your body, and it's like a 3-month report card for your metabolic health. Here is the problem. Medicine treats it as if it's a test for diabetes, when in reality, it's a test of our biological aging. Glycation doesn't just happen in our red blood cells, it happens everywhere in our body. When it occurs in our blood vessels, it causes stiffness, and the result is hypertension. Glycation in our brain causes brain fog and reduced cognitive function. In our kidneys, it damages our filtration mechanisms, and glycation in our skin, none of us like that. It binds to elastin and collagen and causes all of those wrinkles we see as we get older. When glycation occurs in our nerves, it causes numbness, tingling, and eventually neuropathy. This really matters because even a 1% drop in hemoglobin A1C can reduce the complications of diabetes by as much as 35%, including our risk of kidney disease and nerve damage. After decades of working in the ER, I've learned that lifestyle changes alone can actually drop our hemoglobin A1C by as much as 0.5 to 1% in as little as 3 months. When medications are added, you can see a 1 to 2% drop or even more. How much hemoglobin A1C will drop will also depend upon your starting point. If your hemoglobin starts high, the drop is more. If your hemoglobin A1C is greater than 9%, a reduction of 2 to 3% is possible. If it starts at 7 to 8%, you can expect a 0.5 to 1.5% drop. And at 6.5 to 6.9%, smaller but still meaningful drop of 0.3 to 0.7%. For my patient with the hemoglobin A1C of 10.2, a realistic goal that included both lifestyle changes and medication for him was a 2 to 3% reduction. Would bring his glucose average down from 246 to 170s over the next 3 months. Now, let's talk about the people who aren't actually diabetic, but their A1C is high enough to classify them as pre-diabetics. The vast majority of these people don't even realize that their A1C has creeped up into that pre-diabetic range. Why? Because most doctors don't actually test for A1C. So next time you go to your doctor and they want to run that routine blood work, make sure that you ask them to get an A1C. You are in the pre-diabetic range if your A1C is 5.7 to 6.4. If you are pre-diabetic, think of it as a gift of time. This is a chance for you to change course. In just 30 days, you can lower your A1C by 0.1 to 0.3%. I know it doesn't sound like very much, but actually it's a really big deal metabolically, because what it means is now that you can be out of that pre-diabetic range in as little as just 3 months. Take my patient Eliza. She was a 30-year-old with a hemoglobin A1C of 6.2. She wanted to lower her hemoglobin A1C with just lifestyle modifications. So we took a look at her diet and her lifestyle, and here is what she did. First of all, she cut out her sweetened beverages, that coffee with sugar, her sodas that she had mid-morning, and the energy drink that she depended upon in the afternoon. And we also added in some movement after her meals and strength training 3 times a week. 4 weeks later, her hemoglobin A1C was down to 6.0. Then we added in a Mediterranean diet, and within 3 months, she was no longer pre-diabetic. Now, let's talk about some simple changes that you can make right now, starting today. First is you've got to know what your hemoglobin A1C is. Your optimal range that you're going to be aiming for is 5.2 to 5.3. So if your hemoglobin is out of the optimal range, here is what you can try. First of all, cut the liquid sugars. These hit your brain fast and hard. Ditch the sodas, the fruit juices, and also your sweetened coffee. Next, prioritize your protein and your fiber. Start your meals with real food, and they will blunt your glucose spikes. Next, move after your meals. Even a little 10-minute walk after eating will help regulate your blood sugar. Next, set up your environment for success, because willpower alone won't win long term. And start by tracking just one thing. You could track your steps, your glucose levels, or your carbohydrate intake. And lastly, connect to your why. This is rarely talked about, and it can make or break your success. What is your why? Maybe it's your grandkids, your energy, or your life. Let me know in the comments below. And remember, your body does not wait for a diagnosis to start showing that damage. Knowing what to do is one thing. Doing it consistently, though, is where all the magic happens. Here's a quick word, though, about diabetes medication. Medication is often necessary, and there's no shame in that. Today's meds are powerful tools, but I'm not your doctor, so always work with your doctor to personalize your health plan. Now, as promised, let's talk about that one factor that most people overlook. Yet, it can lower your A1C by up to 0.5%, even without you changing a single thing, your diet or your exercise. What is it? It is sleep. Yes, sleep quality and quantity. Try to get 7 to 8 hours of sleep a night and address any issues like sleep apnea or nighttime awakenings. This has been shown to directly improve insulin resistance and lower a hemoglobin A1C. Why? Because your poor sleep will increase your cortisol level, and that disrupts your circadian rhythm and makes your body more insulin resistant, even if you're eating clean and moving regularly. When the patients I work with hit a plateau with their diet and their exercise, quite often the missing piece is their sleep. And once we fix their sleep, their hemoglobin A1C will then begin to improve. It is a missing piece that most people don't even realize is sabotaging their progress. Lowering your A1C is about being intentional, and every choice you make is a vote for your healthy future, for a life lived well and not lived sick. So let's reclaim your health one A1C point at a time. I'm Dr. Joanette, and thank you for joining me today and for your support by subscribing to this channel. If you go to my website, growwithdrjoanette.com, I have created recipes that will help you lower your A1C and support your brain, heart, and body. And we'll see you next time on the Dr. Joanette channel.